Islam history, some epidemic diseases and their effects on the journey of Hajj. And from our Religious Affairs Board experts, Dr. Mehmet Nur Akdogan, you have 15 minutes, sir. Esteemed Chair, esteemed participants, I respectfully welcome you all. I wish from Allah that this symposium will be fruitful, and I would like to thank everyone who made an effort in the organization of this symposium, and I'm grateful for their efforts. My subject, I would like to start with my subject in order to be time efficient. The effects of sub-epidemic diseases in Islamic history on Hajj journey. As you know, since November 2019, at least as far as we know, due to the pandemic of COVID-19, both social and our religious lives were affected. And these were not limited. And we had the impacts of it on the religious life as well, especially in terms of the worships who are performed in a collective manner. They were hindered due to this pandemic. And at the beginning of this worship types, we can count Hajj. And as you know, Hajj is one of the symbols of Islam. And together with that, throughout history, in a non-interruptive manner, it has been performed. Even though Kaaba, the erection of Kaaba dates back to Adam, Prophet Adam, and supported by the revelation, the existence of Kaaba dates back to Prophet Abraham. We can say that the performance of worship continued in a non-interrupted manner. So throughout history, Hajj practice was affected by different economical developments, humanitarian developments on our daily life. And the practice of Hajj was also hindered. And there were some impediments on the realization of Hajj duty throughout history. So we can consider them as impediments against Hajj. So we can count wars, lack of safety in the roads, famine, natural disasters, and also in terms of our current agenda, we can count diseases which are among the hinders and obstacles against the performance of Hajj. Before we pass on the epidemic diseases, I would like to talk about some epidemics which occurred throughout the history. When we take a look at the literature, the historical literature, we see that the oldest epidemic dates back to before Christ, 3,500 and 3,000. And from that era, we don't have any clear data which can show the impact, but we at least know that they existed thanks to the archaeological excavations. And in 541 Anno Domini, what is known as Justinian plague in Byzantine Empire, during this plague, the humans were affected greatly, and what is known as Black Death in the medieval times in China and Europe and India, it was dominant, and millions of people lost their lives. We can see them from the historical resources. And apart from that, we have the great epidemic of Marseille, Spanish flu, which are among the big epidemics. So in terms of history of Islam, in terms of epidemics, if we can count, the most prominent of them is Amman's plague, which is a village in Damascus. And during this plague, in the 17th or 18th year, 25 to 30,000 people are thought to lose their Lives. Ebu Ubeyde and bin Jarrah and Muaz are among the famous people who lost their lives during this plague. We have two titles in this presentation. One of them is Epidemic Diseases Impact on Hajj Journey until the Ottoman Era, and second, the epidemic diseases impact on Hajj journey during Ottoman Empire. I would like to state that their impact on Hajj journey, the reason why we state this is that here we are not going to touch upon the fiqh part of the issue. We will rather focus on the impact of these diseases on the Hajj candidates who set on a journey or once they got back to their homes. What were the impacts? So until the Ottoman era, from resources we have limited diseases who are touched upon. The reason is that, of course, throughout the history there were lots of diseases which occurred, but the diseases who affected directly on Hajj journey, as far as we can identify it, with large impacts, maybe there are some small-scale ones, there are 4 diseases who are at the level of being an epidemic. One of them is Jarif Taunu, which is known as the sweeping plague. This happened through the Umayyad time in Basra. And through that time, as you can understand from its name, it's sweeping everyone like a flood sweeps away everything. The plague is also named after of this characteristic. So, especially in Iraq, Basra region, it has some severe impacts. On a daily basis, 70,000 people lost their lives due to this plague, and within 3 days, 210,000 people lost their lives. Maybe these figures are not exact ones. This can be also an exaggeration because, especially in Basra region, the residents of Basra, it is 100,000 people, but the reason that another figure is mentioned in resources is due to the fact that it's a really large-scale disease, and during that time, no one from Basra went to Hajj, according to sources. And even related to Ibn Umar, there's an anecdote that year, the fact that he never saw anyone from Basra in Hajj, he asked about it, and due to plague, he was answered that nobody from Basra was attending Hajj. Especially in some resources, Maşera disease is mentioned, or Maşeri. It is mentioned with 2 words. This disease has been seen in different periods of history, and the internet resources, Darütül Melik Abdülaziz, Melik bin Abdülaziz, some Saudi Arabia internet portals mentioned this disease. We couldn't confirm this. These diseases happened, but did it have any impact on Hajj journey or not? We don't have any confirmed information. Probably it is due to a confusion. The source of this allegation is Ibn Kesin. He died in the year 357 Hijr, according to Hijr calendar. When we take a look at his works, the same year, famine and drought caused people to die during their Hajj journey. Probably 2 incidents are overlapping and are being mistaken with one another. And by knowing that, that disease also caused thousands of people to lose their lives as well. Shiraz plague, this happened in 425, according to Hijr calendar. It happened in Shiraz region of Iran. Actually, there is no such thing mentioned as Shiraz plague in sources. We just gave it this name. Like in Anbas plague, when plague happened in that region, we just named it after the place. That disease started in Iran, and then it spreads to Ahvaz, another region in Iran, then to Iraq territory. And 70,000 only in Baghdad reported to have lost their lives, and it's a quite severe disease, and people are left to die in their houses. And in the same year, again, due to this disease, no one from Iraq could go to Hajj. Cezire region was also witnessing plague again in year 400. Starting from Baghdad, Basra, Musul, these cities were impacted by this plague. And even there is a letter from Musul, and the sources say that, and this letter says that even only in that period, 400 people could attend to Juma prayer. And according to sources, Musul's population is between 100,000 to 150,000. And the fact that only 400 people would attend Friday prayer, it is clear that it caused a severe damage. And similarly, it had an important impact on Zimmi and Düveyhi's Shiite people who were in dialogue with them, and Sunni people who were their opponents. And the fact that these periods are overlapping were the factors that had negative impact on Hajj journeys. So from that region, nobody could attend their Hajj journey. During Ottoman period, maybe the striking information is from that period because we have more information and data from this period. Hamdül Harameyn. So with Yavuz Sultan Selim, after receiving this title on Hajj, they witnessed two important problems, what we call as urban, the Bedouins who live in the deserts. They would attack the people, the convoys, the caravans passing through the desert. And second of all, the second problem were the diseases. And among epidemic diseases, during the Ottoman period, plague had a severe course, but there are really few information showing its impacts on the Hajj journey. 12,000 people lost their lives in Mecca and Medina during their Hajj in 1822. And apart from that, we don't have much information, but especially since 1830 until 1910, the cholera plagues, cholera diseases caused a lot of damage on the Hajj journey. During this 85 years of period, there has been a cholera epidemic for 22 times in Mecca, not on in Ottoman territory, and first of them occurred in 1831. However, Dr. Kasım İzzettin, he is one of the physicians of Hijaz sanitation department, and I have taken a look at the report he prepared. He has a book titled and published by this institute, and we see that the source of disease is not Mecca, is not Hijaz. The source is India, and this is stated clearly. And in 1917, the cholera witnessed in India, this is a continuation, and this is not only accepted by the Ottoman but also by the Europeans. You have lost 2 minutes. And this epidemic of 1831, and doctor considers them among the biggest calamities on the public, and more than 30,000 people lost their lives, 15,000 people lost their lives. And after that, Ottoman Empire starts taking certain measures. However, the measures taken is not influential at the desired level. And in 1836 and 7 even, you can see it from sources that there are different years that are mentioned. During that period, again, we witnessed cholera epidemics, but they are lighter compared to the first one. And in 1865, as that year is Hajj Ekber, there are 30,000 candidates that year who lost their lives, and there was a big problem that year. And together with that, the measures taken partially were effective, but they couldn't prevent the disease. Again, thousands of people lose their lives. In 1893, the historical sources states the most severe case. And again, Hajj Ekber, as stated by Dr. Kasım İzzettin, there are 200,000 pilgrims that year, and according to sources, 30,000 people lose their lives. And unofficial resources mention it as 50,000 people. Especially after the returns from Mina, disease takes a more severe course and it loses more deaths. Of course, I would like to state one fact that, especially in after the epidemics of 1865 and 1933, European states who are attached to them, they start preventing pilgrimage to these places. For example, pilgrimage from Algeria and Morocco are tied to severe conditions of monetary measures, for example, and if you don't pay that amount, you cannot go to Hajj, to perform your Hajj duty. I'm just wrapping up. Thank you. So in conclusion, I can say that in history, before the Ottoman Empire or after the Ottoman Empire, the epidemic diseases, in none of them, Hajj was not completely prevented from taking place. And in addition to that, measures were taken. And I believe that there are a lot of resources saying that these measures were not enough. Even though the disease is known to come from India, Hajj people coming from India were not prevented at any time. Some measures are taken. There are high numbers of death tolls, but there was never a strict and absolute ban on Hajj journey. Thank you very much for your patience. We would like to thank Dr. Mehmet Nur Akdogan